Hello, my name is Robert Brill. I'm a fibromyalgia advocate and PhD candidate in health psychology, and this is my Fibromyalgia podcast series. Today I'd like to discuss opioids. What do they really do, and why don't they work so well for fibro? Opioids, or oftentimes called narcotics, can come by many names, and quite simply they attach to the opioid receptors in the brain to block the perception of pain from the body, decrease the reaction to pain, and increase pain tolerance. So those are the three things that they do. Opioid receptors are actually located in the brain, spinal cord, and GI tract. Nerves send and receive feelings of pain, and opioids stop this function. So if the nerve message doesn't reach the brain, you don't experience pain. They also can provide antidepressant and calming effects for many people. The body produces its own indigenous or natural opioids, very similar to morphine. But your body will not produce enough natural opioids to combat the level of pain most often seen with fibro or with other chronic pain conditions. An opioid acts as a neurotransmitter does, activating pain receptors. The brain does not differentiate between natural or synthetic opioids, which means that the medicine will attach to nerve receptors and activate them. So here's what happens with pain conditions that become chronic. Opioids are chemically similar but not identical to the natural neurotransmitters in our brain, and eventually these messages that are being sent to block pain become distorted and abnormal, leading to more pain. That's essentially it. This is also similar to developing a tolerance to narcotics. The longer you take them, the less they work. The message that gets sent to the neurotransmitter is dopamine, which regulates cognitive functions, emotions, pain, movement, motivations, and pleasure. So an opioid does not eliminate pain. It stops pain transmissions, and it alters the sensation of pain. So the big question is, why don't opioids work that well for fibro? The use of opioids to treat fibro is debatable, as it is for many other chronic pain conditions. According to the research performed at the University of Michigan School of Medicine by Dr. Harris, the primary reason opioids don't work well for fibro patients is that they're suggested to have a reduced binding ability of the pain receptors in the brain. So there's a physical change here. And as such, this is why many physicians won't prescribe opioids for fibro, believing that they're fundamentally ineffective for people with fibro. Again, this is debatable because some people do well with opioids for their fibro pain and some do not. PET scans have revealed that fibro patients do have a reduced number of mu opioid receptors. These pain receptors process pain messages. Reduced receptors would translate into an increase in pain. So when you take opioids for pain relief, they have less receptors to bind to and reduce the pain. In fact, most chronic pain conditions have this similarly reduced pain receptors. Additionally, the reduced number of opioid receptors means a reduced release of our natural opioids like endorphins, meaning more pain. According to the Journal of Neuroscience, PET scans also revealed that there are a reduced number of mu opioid receptors in the amygdala region of the brain. This results in an increase in depression and mood disorders, further resulting in pain.